KCBS, in partnership with UCSF Health, presents As Prescribed, a weekly conversation with leading medical experts from UCSF Medical Center and UCSF Benioff Children's Hospitals.
Hello and welcome to As Prescribed. I'm Alice Wertz. Irritable bowel syndrome is the most common cause of abdominal pain in children. About 10 to 15% of kids have had it at one point, and it can be stigmatizing and lifestyle limiting condition to have. But UCSF has a unique wearable device that helps kids manage GI pain when other treatments have proven to be ineffective for them. To tell us more about this today, we're joined by Dr. Vivien Nguyen. She is a pediatric gastroenterologist at UCSF Benioff Children's Hospital, Oakland. Thank you so much for joining us today, Dr. Nguyen.
Thanks for having me, Alice.
Can you help us understand what IBS is, irritable bowel syndrome, and how many kids are affected by it?
Yes, irritable bowel syndrome is one of the pain predominant disorders of gut brain interaction. So basically, it is a glitch in the communication between our gut and our brain. Um, and it occurs even in the absence of harm or injury or inflammation to the intestinal tract. It's hurt without harm, really. And I think that it's not as widely recognized amongst parents, and so I think that learning a little bit more about it so that you can identify it in your kiddos is really important. It can definitely affect quality of life. You know, pain can cause kiddos to not be able to attend school, to participate in their extracurricular activities, to enjoy the things that they like to do with their friends. And that can be very limiting and damaging to kiddos. Um,
So is
mhm.
Yeah, I was going to say, is what's unique about IBS in children?
Yeah, it's very common. Anywhere between 10 to 15% of the population experiences irritable bowel syndrome at one point during their childhood. And there are so many different factors that play into the development of this disorder. Again, it's a miscommunication between the gut and the brain. And so many different things can play into it, including genetics, um, physical stressors like having a cold, having a stomach flu that can be a trigger for the development of irritable bowel syndrome. Early life and early childhood trauma can definitely play in to the development of this disorder. There are other factors too, so environmental exposures, medications, dietary differences that can all feed into the development of this. So, what happens is the intestinal tract starts to notice normal digestive processes and send alarm signals, pain or nausea to the brain. And then the brain goes, oh no, we're under attack. And it becomes much more hypervigilant and sends signals back down to the gut that says, oh, we got to keep an eye out because something is trying to attack us. This becomes this feedback loop that's very hard to get out of.
So tell us about the wearable device. How does it work? And how is it being addressed for children?
Right? So the device is based on actually pretty ancient, uh, knowledge about how the body works. So 2,000 years ago, traditional Chinese medicine used acupuncture points on the ear because they noticed that the auricle is connected to different organ systems. So, in modern medicine, they found that you're able to access the vagal nerve. You're able to stimulate the vagal nerve by placing electrodes on the ear. And that's what this device does. It's called a percutaneous electrical field nerve stimulator, PNFS. And there's these tiny little titanium electrodes that go into the skin of the ear. And then there's a generator that's placed behind the ear. It's very small. That generator is powered and sends a electrical impulse to those electrodes. That then goes to the vagal nerve centrally to the amygdala, which is kind of the pain processor of our brain, to turn down the signal of the pain that these kiddos are feeling. The device is worn for 5 days in a row, and the kiddo comes back every week for 4 weeks in a row. And that completes the treatment. And I like to think of pain or chronic pain kind of as a software glitch, right? So this is kind of like rebooting your computer.
Fascinating. And what has been the feedback you've had from patients and pediatric patients and their families in regards to this new treatment device?
Well, the clinical trials show that has been great response. Over 80% of patients who have this treatment have some improvement in their pain, and 60% of children who have this device placed have a significant improvement in the worst pain, the debilitating pain that's keeping them home from school, that's keeping them from living their lives. And my patients have had great success with this. I've had a few patients who have improved so much that I actually don't see them in my clinic anymore, which is wonderful to see.
Yeah. And is it commonly used throughout the U.S., throughout our region?
No, we are the only center in the Bay Area that provides this treatment. The nearest centers are UC Davis and Children's Hospital of Orange County. It's only been available for the past 4 years. It was FDA approved in 2019.
What is your hope with this new technology?
I'm hoping that we can add this to our armamentarium, things that we can use to help kiddos with irritable bowel syndrome to get better. Um, we are so limited in the evidence based treatments that are available for children. We know that cognitive behavioral therapy, for instance, hypnotherapy, those are very powerful for treatment of irritable bowel syndrome. But in terms of medications, there haven't been that many clinical trials. There's no FDA approved drugs for the treatment of IBS. And so having this treatment available is really powerful, I think. And I think that intervening early, diagnosing irritable bowel syndrome, knowing that your kiddo's, who's got that tummy ache for a while, maybe needs to come and see somebody about it and get these treatments earlier on so that there isn't that prolonged intensification of that feedback loop that I talked about between the gut and the brain.
This is a fascinating topic and certainly will help families and children who are suffering from irritable bowel syndrome to have an option for treatment. Thank you so much for sharing about this treatment for kids suffering from IBS, Dr. Nguyen.
Thanks so much for having me.
Yeah, we've been joined today by Dr. Vivien Nguyen. She's a pediatric gastroenterologist at UCSF Benioff Children's Hospital, Oakland. Thanks for tuning in to As Prescribed. I'm Alice Wertz.
As prescribed every Thursday at 1:30, right here on the Bay Area's news station, All News 106.9 and AM 740 KCBS, and streaming on the Odyssey app. The proceeding was sponsored by UCSF.